Well, thank you all for being here today. And I want to start quickly by thanking Anla for pulling together such a great event here today, pulling together such a great group of people. I think we're honored to be on the healthcare panel. So thank you, Anla. I can't see you out there, but I'm sure you're somewhere. So the title of the panel is The Future of Private Healthcare in China. Now, as we've been talking about, this is a big topic and something that could probably cover an entire day of a conference, but we've only got an hour, and we've got a lot to cover. So I'll try to focus our discussion on a couple of areas, one being the huge growth of the industry and the changes in the industry that are driving that, including policy, some of the opportunities that have sprung up as a result of this, and some of the issues such as regulation, the role of the government, and other issues that one needs to be cognizant of if you're an observer, participant, investor, entrepreneur, or just an average citizen sort of looking at healthcare in China. Now, by way of introductions, my name is Jamie McCarran, and I'm going to be the moderator of the panel. I am with a firm called Innovating Global Health. We're a venture capital investment and advisory firm. We've been investing in healthcare services innovation for about 20 years with a focus on the US and Europe primarily, but for the last 5 years, we have focused our efforts on China, which is why I'm here with you today. By way of our panelists, we've got a great group of panelists with us today. To my left is Roberta Lipson. Roberta is a pioneer in private sector healthcare in China. Many of you will know that she founded Chindex back in 1981 and has been a real driver of the growth of private sector healthcare in China since then, including with her United Family Healthcare network of clinics and hospitals, and more recently in areas such as primary care, home care, and most recently insurance, I believe. And so we're looking forward to hearing from Roberta, and thank you for coming all this way from Beijing. I think you're hitting your jet lag day, but I'm sure she'll do great. Next to Roberta, we have John Foster. John has a distinguished career of over 37, nearly 40 years of as an entrepreneur, as an executive, and investor in healthcare. His firm, HealthPoint Capital, focuses on the musculoskeletal space, which is a very interesting space, especially with the aging population in China. I think he first visited China about 20 years ago, but have really spent the last 5 years looking at ways to take some of what we've perfected here in the West and adapt it for the Chinese market, bring it to the market, and invest in it there. Next to John, we have Pei Quen Cheng. Pei Quen is focused more in the biotech and pharmaceutical space. His company, Eviva, is developing some compounds in cancer and other areas and is in the process of beginning some interesting phase 2 clinical trials. One of the things that I think is really interesting about his background, and I think will contribute a lot to the conversation, is the focus that he has on sort of the marriage of Western and Eastern medicine, TCM in China, and the important role that's playing in China today. And then we have Mei Li on the end. Last but not least, Mei is with Johnson & Johnson. She focuses more on the not-for-profit space, but in a very interesting area focused on maternity and neonatal care, focusing on training and education, the development of clinical skills, and patient education. All of these are areas of tremendous need in China today, and I think are driving a lot of the change that's going on in China today. So we're very glad to have you with us here today too, Mei. So with the pleasantries out of the way, I thought that we should focus on a couple of things. And given our tight schedule, we're going to try to keep this, I'm going to try to keep my comments brief and really hand it over to the panelists because we want to have an interactive discussion. While our discussion today is focused on private sector healthcare, I think we must be aware that as in every other industry in China, the Chinese government plays a huge role in what happens in healthcare, be it as an owner of real estate, the grantor of licensees, a more traditional regulator, but also importantly by way of the policy that they make and that they communicate to us. And so any successful private sector healthcare company or initiative in China, I believe, and I think the panelists share the belief as well, will definitely have to take into view the role of the government as they look to develop opportunities and projects. So for a number of years, the improvement and expansion of the healthcare system has been a key imperative of the Chinese government. And in the fall of 2016, the government launched its Healthy China 2030 initiative, which some of you may know of. The initiative made public health a precondition for all future economic and social development. And so I think it's interesting how they've interwoven healthcare and the health of their population with social aspects and with the economic development of the country as well. And so the program outlines not only some general goals, such as improved levels of general health, more of a focus on prevention, and reform of the system and management of the system itself, and innovation in areas like TCM, but it's really also, interestingly, set some targets for things like average lifespan, infant mortality, and some other indicators. And so they're actually trying to measure outcomes, which is something that in our experience, and looking forward to hearing from the panel on this too, is something that we haven't necessarily seen in the past, measuring of hard outcomes. And so most recently during the 19th Party Congress, the president once again reaffirmed the importance of healthcare for the economy and for the Chinese people. And the quote that I have from him is that a healthy population is a key mark of a prosperous nation and a strong country. And so I think this is something that was woven throughout a lot of his remarks and is definitely a key initiative for China. And so I think all the panelists and many of you will agree that today the Chinese government's policy forms a backdrop for virtually everything we do in healthcare and everything that we look at as investors and as entrepreneurs. And it's important not only to the growth of the system, but as a whole, but for the private sector's role in that healthcare system. So with that, I've said enough, and so I think let's jump into the panel. And I think a good place to start would be maybe with Roberta, with you. Maybe if you could talk a little bit about what you see as some of the primary factors driving growth, and given that you have been involved in the system for nearly 40 years at this point, a little bit of historical perspective on how we've gotten to where we are today.
Okay, thank you. I think it's no news to anybody that the population in China is getting older, sicker, and richer. When we look at the burden of the aged population over 65, 5 years ago it was 7% of the population. By 2020 it'll be 12%, and by 2050 it'll be 22%. That will be something like 350 million, which is the population of the United States. So China will be taking care of a population the size of the United States of old people. And there's no question that the burden of disease as a result of air pollution, cancers, the rates of cancers growing very quickly. The age of cancer onset, especially for women's cancer, breast cancer, is much younger than the United States. So the need comes from, first and foremost, a demographic change. Secondly, the government not delivering a suitable response to that growing demand in healthcare is, I think, potentially the single most possible cause of social instability. So if we look over the last 20 years, the hot points of social instability that really stemmed from dissatisfaction with healthcare, you can look at Falun Gong. You can look at the social response to SARS. You can look at the population's real fear of the results of catastrophic disease in their high savings rate. So the fact that the government is starting to take that really seriously and change the conversation about what to do about this problem is great. And I for one, am extremely encouraged by both the Healthy China 2030 paper and the focus of healthcare in Xi Jinping's 19th Party Congress speech. So in the last 20 years, when I first got to China, which is ages ago, specifically 38 years ago, and started looking at what was available for healthcare, the Chinese hospitals really had no new technology. And that's changed a lot. Chinese hospitals in urban centers are very, very well equipped. But the issue is that the focus on building hospitals and building hospital beds makes a very reactive approach. And so the fact that the conversation is switching to not only building more hospital beds, but issues of prevention, issues of public health, issues of food safety, makes me, for one, very happy. You might think that's strange because we're in the business of building hospitals and clinics, but really the goal of our patient encounters is to keep people healthy. And I can talk a little bit about that later. You mentioned our insurance initiatives, but I think perhaps we'll go down the line and we can come back to that conversation.
First and foremost, anything I say is subordinated to what Roberta says. And I have been going to China for 20 years and have been in and around the healthcare service business in the last 5 years. And our experience has been that a policy comes long before reality. And that is to say that it's a highly structured environment from a bureaucratic point of view. And what is policy is very often not the reality on the local scene. And so there needs to be clarity between those two concepts. And I'd also say, as we're in the healthcare services business, that there is incredible growth. Healthcare is growing at 35% or so a year in China. But the healthcare services business, I think, will grow much more slowly. And it will grow much more slowly because of the inadequacy of service-trained professionals. And as a result of that, I would expect for the next 20 or 30 years to see continued opportunity in the service area, which will be served by introducing concepts and procedures from the West, where over more than 10-year periods, pharma, equipment, devices that initially are foreign-driven become domestically driven.
So one of the challenges I think you sort of brought up there in supporting this growth is training and education, which is severely lacking. And I know that, May, some of what you're working on is interesting. Maybe you could talk to that about how the programs that you are developing at J&J are improving results in in the maternity and in infant mortality rates. But then I think there are some challenges too that we've talked about amongst ourselves, and maybe we can come back, Roberta, and you can talk a little bit about some of those challenges that we're seeing or that you're seeing in medical education and training and education generally, and how that could be limiting the growth of the market too.
Thank you. So before I talk about the training education, and since we're on the topic of opportunities, and Roberta touched on aging population, and I'm going to talk about babies. So I think you've all heard about the two-child policy, and before that policy in place, and the average annual birth is 17 million. And so we sometimes say that every year China gave birth to a size of Australia. So in terms of child mortality, during the Millennium Development Goal time and globally, and China had made a lot of progress in improving child survival and contributing to the 17% of reduction. However, again, globally and China, you see the gap in a newborn. We're talking about the first 28 days. The gap in the newborn death happening. And a couple years ago, Lancet series did a study and published study on this gap. And China, I hope you'll be surprised, and China ranks number 4 in terms of the number of newborn deaths globally. So think about this. There's more babies dying every year in China than in Ethiopia. So with that need and also this new two-child policy, and I think you have the opportunity in the aging population, you also have opportunity in terms of improving maternal newborn child health, and which has huge impact on development, human development, on productivity, workforce. Moving on to the training and education. So Johnson & Johnson have been partnering with the Chinese government for the past 10 years on a newborn resuscitation program, which addresses one of the leading causes of newborn death. So the training in the past years has covered the entire country, and about 90% of the health facilities has been adopted the training. And we've learned a lot, and this is one of the success stories, and we tracked on how not just the skills improvement among the healthcare providers, but also how that impacts on mortality and morbidity, because you can save a child life, but sometimes if you don't do it right, and they are survived, but there's a long-term disability. So I would see that the learning from this partnership is that if any advice that I would give is that if you are partnering, if you're doing something that's also aligned, very closely aligned with what the government priority is, that's your best return on investment. And I wouldn't say you're guaranteed success, because you still have to overcome a lot of hurdles, but the government would put a lot of resource into what you're doing, and also policy around it, because some of you may know that the way the Chinese government works is that the provincial, the city, the county level, all these trickle down government officials, their performance measurement, they have certain things that they have to meet, and so the central government would actually require these lower level government to fulfill the training obligations. And another thing that's very important is to involve the professional associations. The professional associations in China have kind of a less legislative power compared to the professional associations in the US. So the government says, well, we should train the nurses, and so that they can do resuscitation. And so they just made that policy right there. And anyway, so I'm rambling now. But anyway, so the key takeaway is that you do need to collaborate with the government and making sure that what you're doing is aligned with the government priority, and that would make your life much easier.
So yeah, 2 points. First of all, just an interesting follow-on to your second child policy building opportunity and demand. Absolutely, I'd agree with that. United Family actually led with a very successful obstetrics and gynecology and then pediatric service as an entry point for our patients. But over the years, that's been an important business to us, and certainly the second child policy has been a boon to us. But at the same time, the second child policy has made 2017 a really bad year for infant death. And that's because all of a sudden, mothers at the age of 40 and 42 finally said, wow, I can have a second baby now. So hospitals were faced with older mothers, which it's always a higher risk pregnancy, and the hospitals had no experience with multiparous births. They've only done single child births. So yeah, so that's just an interesting aside. I would totally agree with you that it's always good to align yourself with government policy. It makes life easier going with the flow. But when we started United Family Healthcare 20 years ago, one of our goals was to not only hopefully have a profitable business, but also to show a different way in healthcare and maybe give some ideas to the government about what a good way to go might be. So when we encountered a very highly specialized and stovepiped system of highly specialized healthcare, which is one of the problems that are overwhelming the major public hospitals in the cities, because people think in terms of specialty health. So even with a common cold, people tend to go to what they think is the best hospital. There's, until recently, until the private sector came in, very little clinical, community-based clinic health care, outpatient care. So people tend to think about going straight to the specialist at the hospital, even with a cold or a flu. And I saw that this didn't make sense, and so when we started our first hospital, we had the most doctors in family medicine and general pediatrics, and started showing that if you provided really good primary care, people would actually be willing to pay for it, and very gratified to see that improving primary care has become one of the major focuses of government policy. There's, in fact, an initiative over the next 3 years to train 150,000 new family medicine doctors, which is quite impossible. So unfortunately, one of the things that's happening is the government is doing 3-week retraining programs, or sometimes from 3 weeks to 3 months, taking other specialty doctors and retraining them as family medicine doctors. Actually, it's quite impossible to train a good family medicine doctor in three weeks. So what's happened is it's sort of perpetuated people's lack of confidence in community clinics, and so they continue to go to the big hospitals. And so now, even with all of the hospitals that China's built over the last 20 years, and the number is quite staggering. Government has built a lot, and because they've started saying about 5 years ago, we encourage private investment in healthcare, there's been a lot of private hospitals built, but people are still flocking to what they think are the best 3A hospitals. So all in all, public hospitals have nationwide 85% occupancy, but in the big cities, the best hospitals can have 120% occupancy. So they're very overcrowded. And people the government realizes they need to redirect people to primary care, to community clinics, but the challenge is training enough doctors. We recognize the challenge, so we started out importing a lot of family medicine doctors, returnee Chinese and Westerners, but as our business has now become 85% Chinese patients as opposed to the 99% expat patients we had when we started, we realized we can't continue to import that talent. So 5 years ago, we started our own 3-year postdoctoral program in primary care medicine, family medicine, and emergency medicine. And obviously, we're not going to make a dent in the 150,000 needed family medicine doctors, but I think that's another opportunity is medical education. And I have a lot of passionate things to say about medical education and the way it's being done in China being one of the causes of the crisis of doctor-patient relationships. And yeah, at some point in this discussion, I'd love to talk about it, but maybe we should ask Pigwin to talk. Yeah.
Yeah, well, and also, and John, I just wanted to ask you first, as you're sort of looking at bringing, some of these Western practices to China and building businesses around it, I think you've indicated to me, at least over breakfast, that you're running into some challenges, not just on the physician side, but it's also the training and education of management of how to run healthcare services businesses in China.
Yes, the shortage is in our case, we're in the rehabilitation business, allied healthcare professionals. And the quality of care in the West is very different than in China at this time. And therefore, at the outset, as Roberta has suggested, it's importation, or at least importation of Chinese professionals who have had training in the West. I would say further that, in my judgment, what we're experiencing in China is going to be very much the experience that we've had here in the last 40 years. In 1983, as you know, DRGs were installed, which moved reimbursement to fixed fee from cost plus. And as a result of that, well, let me back up. There were 7,000 hospitals in this country, and all of the services of healthcare were principally provided in the hospital. When DRGs came along and you didn't get plus 5% for everything, all the services were blown out of the hospital except for the ER and the operating room and the intensive care unit. Over the last 30 years, the individual segments of services have been individually developed such that the silos, if you will, are now strong with both management and clinical capability, and hence 35 or 40 years later, we're now seeing the major hospitals bringing back under their tents the other services that they heretofore had not been able to provide. And I think we're seeing the same thing for different reasons in China, and that is my expectation would be that the services are going to be largely developed, the innovative services are going to be largely developed outside of the government hospitals, and maybe in 35 or 40 years, they will then be reaccumulated. Now, as I often say, the what is the same, the how is very different, but something along those lines, in my opinion, is what's taking place there, in contrast to where we are. We just happen to be at the opposite portions of a cycle.
Yeah. Well, and I think supporting growth in the development of a healthcare system it includes a lot of training and education of physicians, training sort of patients to understand how to use the healthcare system, move away from sort of using the general acute care hospital as your sole point of contact and moving into the community. But innovation in the system is also incredibly important. And so a lot of the work that you're doing, Pei-Wen, is in innovation, more in pharmaceuticals, but in trying to streamline or work in ways that can streamline bringing those more innovative treatments into the healthcare system. Maybe you can talk a little bit about that. And I think what was really interesting in our first conversation was your, I'm not going to steal your acronym for it, but the marriage of Western and Eastern medicine and TCM in China, and TCM, improving and innovating in and combining TCM with Western medicine is part of Healthy China 2030. So maybe you can talk a little bit about that.
Yeah, sure. I think overall, there's a lot of potential in healthcare, not just in China, but in the United States and worldwide. But regardless of markets, it takes an ecosystem. So you need all the components. You need government support. You need the talent. You need the innovation. And so that really spans the full spectrum. Just sort of touching on some of the other topics earlier, in terms of training and education. I mean, that's definitely key. I mean, we look at anything from, so our company, we're researching ancient medicines and then modernizing them through the latest technologies into future medicines. And there's a fertile ground to be researched in terms of these traditional Chinese medicines. And that leads through that research through a number of challenges that you need to overcome, right? And I think it goes from, if you're studying botanical drugs, do you have a quality supply, right? So then it's talking to farmers on how you grow. Does the provincial government understand that this actually can better the economy? Can the farmers understand not to use pesticides and fertilizers in certain ways? So there's education and training involved there. Then there's when you actually, start to study these types of botanical drugs, there's a lot of modern science now that can open up these black boxes. And I think there's a lot of potential there to use the knowledge and best practices of East and West to learn from each other, because they don't have to be used in silo, but they could be integrated. And through this, we can come up with new medicines. And so we have a philosophy, which Jamie sort of touched on, we call we medicine. And so West representing W, East, East. But really, the foundation of Western medicine has always been on evidence, East on using experience, and then we see we being really about efficacy and patient outcomes. And so by applying modern science towards drug development, we can come up with new solutions. And I think there's a lot of novel approaches that will come, and there's training that also happens in the research and development side. Also on the clinical side. To do good trials, right? To have quality data, to build that trust, to be able to share that between different territories. That also requires training. I know that Beijing United is in that process of getting certification there. So all this, by raising the standard of the overall soft skills in China, will be a big benefit. I think China has never really sort of it's very strong in hardware, but the software is an area that will continue to improve. And to give an example, on the regulatory side, the CFDA knows that it needs to sort of facilitate the drug approval process to help drive this innovation. And one of the bottlenecks has been the number of reviewers. In the past, it's been 60 reviewers up to 100 reviewers. And then recently, they've jumped up to 800 reviewers. And the goal is to hit 1,600 reviewers by 2020. And that's in comparison to today, the US FDA having about 2,000 reviewers. And you can see how that sort of big gap is a bottleneck. But the CFDA recognizes this and is now in the process of recruiting people and training people. So I think all this stuff takes time. So there's like a life cycle part of it. But the encouraging thing is that it is happening. And the pieces are coming together from the financial side, from the innovation side, and from the government side.
Sort of following up on that, so as this becomes further developed in China, I think one of the interesting things we're seeing on the services side, simply because of the volumes that they have in China and the number of patients that they see with certain conditions. What do you see as the opportunity to take a lot of what you're doing there then and sort of bringing it back to the West as an opportunity to sort of grow to grow the Chinese market by looking outward as opposed to just facing inward?
Right. So our thought is medicine is medicine, It doesn't matter if it's from east or west. If it, does good, then we should figure out ways to improve its quality and improve access. So I think, Xi Jinping has made a big initiative on healthcare, and within that, Chinese medicine. Chinese medicine, they hope to increase understanding, increase safety, efficacy, show synergies between Eastern and Western medicine, and then to globalize it as part of its One Belt, One Road initiative. What our approach is probably sort of a hybrid between the two. My team is, we're launched out of Yale, working with a team that's focused on developing Western medicine. So we're really coming at it from a rigorous science approach and saying, you know what, there are things in Chinese medicine that have been used for thousands of years, and if it didn't work, people would have stopped a long time ago. Can we now use modern science to understand it? And can we use the best manufacturing processes to create a quality product, right? And then build trust. And I think that's been a big gap. Now, what could those products be? So they could be along the spectrum. They could be prevention, which we talked about earlier. They could be treatment, right? And there's a full sort of portfolio of healthcare products that we can advance. And I think that's what's really exciting, and there's an opportunity to sort of open up this whole new field of science for everyone. And we work with colleagues in Europe who are studying indigenous plants there, people who are doing all sorts of research. So I think there's opportunities to learn from all over the place. So.
Well, and from the other three of you who are more on the service delivery side, what do you see opportunities for China to really develop this domestic healthcare industry that can be sort of a net exporter, if you will, of healthcare services or best practices, as opposed to, I think, what it's doing a lot now, looking outside to bring in best practices from Europe and the United States in an effort to improve the system?
I think we still have a long way to go to solve a lot of the sticky problems domestically. Although, of course, there's also a will to say, there are, I can't say the number, lots of Chinese people going abroad for healthcare still. There are people going to Hong Kong for HPV vaccines, people going to the US for cancer treatment because cancer drug approvals are 5, 6, 7 years behind. And then there are the overcrowded hospitals, and there's overuse of antibiotics and all kinds of reasons people are afraid of the public system. So I think we have a long way to go to solve those problems. And the government, I think, has wisely said, we can't do it all ourselves. Private capital, please come and help. And so, you mentioned how, business should follow policy, and policy makes the opportunity. So we're now seeing all kinds of hot money coming into healthcare services. Real estate developers investing in building hospitals and all of a sudden becoming healthcare providers. Coal miners building hospitals and wanting to become healthcare providers. And frankly speaking, I'm very worried about that, because having spent the last 20 years building people's trust that, if you're dissatisfied in the public system, you can come private, I'm afraid that some of that money that's looking for a return that's faster than ethically possible to get in healthcare is going to go and ruin that trust. Doctor-patient relationships are still at crisis level in China. Partially because doctors are overburdened, partially we talked a little bit about medical education. I personally have this view that Chinese medical education starts from the first year of college, and by the second year of college, you're specializing. So people who are doctors in China now have been asked to make the decision to go into this very difficult profession at an age when they're still kids and they can't possibly know what they want for themselves. I'm a great believer in the US approach to graduate medical education. So, there's so much that needs working on locally that although I think the government would love to see all of those things solved overnight, and they're doing really interesting things, like asking hospitals to have zero markup on pharmaceuticals, whereas hospitals used to finance their payrolls by selling pharmaceuticals. And so what that meant is if you went to the doctor, you would walk out with a big bag full of drugs and not know which ones you really needed and which ones you really didn't need. And so the government's doing really big things by saying, okay, hospitals, you can't have any markup on drugs, so you have no incentive to sell too many of them. So instead, the hospitals are compensating by over-testing. So you don't want to buy my drugs? Come and get a CT. You have to have a CT, or you know. So there's all kinds of sticky problems that need solutions. To the government's credit, they are doing a lot of experimenting with innovating, for example, in payment models, pushing out DRGs, as you mentioned, so diagnostic-related groups that if you go to the hospital, for example, for hepatitis or for a specific kind of surgery, a hip replacement, for example, there's a price that you have to pay, and that the government reimburses the hospital for. And you can't say, I use this kind of implantable, I use this kind of anesthesia. And so as the standard is fee for service now, you pay for every single service you get in the hospital. Instead, they're changing that to a DRG. That brings also other kinds of moral hazards, such as undertreatment, et cetera. I'm a big believer in hospitals being paid prospectively for keeping populations healthy, and the amount of payment depending on how well they did. So you mentioned that we have this new insurance collaboration business, and that's a model where we can sell our patients an insurance product and earmark a certain amount of it for prevention services and health maintenance services, and then at the end of the day, if we do a good job, keep the patient healthy, we share the residual premium with the insurance company. Everybody's happy, the patient stayed healthy, we made a profit, the insurance company made a profit. And I'm hoping that the government will look at that model and say, wow, that makes sense, we should do it that way too. So, yeah.
Well, any other thoughts from the panel on that, or?
So on the, transfer what works in China to the West, and I'm taking my J&J hat off, and I don't have the experience with the J&J experience, but I do have an anecdotal story from a friend whose mother is a doctor, is running a clinic in Kentucky, and she treats veterans with PTSD. So there's a lot of side effect and pain management, so a lot of issues with that. And one of the things she did, apparently has been successful, and the business is booming. So she came to China and studied at the traditional medicine on acupuncture. So now she's using acupuncture to treat some of the veteran pain management. So that's just an anecdotal story, and I agree with Pei-Kwan, and then there needs to be study to see what really works.
Okay. Well, we've only got about 10 minutes left, so I think, there are probably a lot of people out here who have interest in China, either from a social perspective, as entrepreneurs, and as investors. And so I thought maybe you could give us your thoughts on maybe what you think some of those gap areas which really need focus, and where we in the West can provide some answers. I'll let anybody jump in, or I can encourage,
I'm happy to jump in.
Yeah.
I want to touch on I'm a big believer on private business for public purpose. Mm-hmm. And I think the issue of equity is, hasn't been talked much. And I mean, I only came here, later today, and there's a lot of really hot, exciting topics. And But for someone who growing up in China in the northwestern part of China, and I feel, okay, you're talking everything in a first-tier city. It's very exciting, but we have a huge population living in a second, third county, township level. That's not so relevant to them. So one thing that the current government is focusing on is equity. And there's a lot of resource being put into building the infrastructure in rural China. And you do see some Chinese companies start investing in setting up companies in mainland China, moving from coastal to China, so service will follow. So I do think that for healthcare and focusing on kind of for more lower level cities or county, even rural, it is both an opportunity and also it's for public purpose. Doesn't matter what health issues you're trying to address.
But that development of a primary care capability and prevention issues is applicable both to rural and urban China. And I think a focus on, so I really hope that the investment in rural China doesn't go toward building fancy hospitals, but rather starts with primary care and prevention. I'd also like to share an experience that I had this summer. We do a medical mission to some underprivileged part of China. This year we traveled through Ningxia doing breast and cervical cancer screening and treatment. And it really drove home to me so clearly how important it is that China speeds up the approval of preventative tools like the HPV vaccine. Because in screening rural women, we found, number one, that if you find HPV positive and treat it at the same time, you've prevented that woman from having cervical cancer in the future. And then we found all of these women who unfortunately already had cervical cancer that could have been prevented. And the fact that China has only just approved a bivalent HPV vaccine, whereas we have a third-generation vaccine available in the United States, and the vaccine has been available for many, many years. There's whole generations of Chinese women who are at risk for cervical cancer in the future because there were only 80 surveyors, or for whatever reason, or for protectionists waiting for a local vaccine to be developed. Whatever the reason is, we've just caused lots of women to have cervical cancer for the next 50 years. And to hurry up and speed up those kind of preventative initiatives in rural China would mean more than building 50 more hospitals. So, yeah. And that's an opportunity. Push prevention. Yeah.
Okay.
I would simply encourage the Chinese government to invest more heavily in clinical education. It is an enormous need, and there is nowhere near enough support for education. Certainly a big player on a relative basis is Johnson & Johnson, bringing Chinese professionals here and taking U.S. or Western professionals east. There's a friend in the audience who's taking a PhD program to PKU, but the only reason that it's getting there is because it has private philanthropy supporting it. And there are many, many instances where even the best institutions in clinical education are substantially under invested in with respect to education.
Hey, Quinn, any sort of
Parting
thoughts?
I mean, I think What I see is there's opportunity for convergence in medicine between East and West, that often we have similar concepts, but we may have different ways of talking about it. We may talk about systems biology in Western medicine. Well, there's the idea of holistic medicine in Chinese medicine. There's personalized precision medicine in Western medicine, and you have individualized treatment in Chinese medicine. You have increasingly more and more combination therapies, because single compounds going after complex diseases don't work very well. Well, botanical drugs are inherently polytarget, so they can do things that other drugs can't. So I think there's a lot of concepts that we can sort of learn from each other, and I think that's an opportunity. I think the US FDA is moving in that direction as well. The US FDA has paved the way for botanical drugs. It's created a botanical drug guidance and issued so far 2 versions of it, first in 2004 and the second in 2015. And I think what they have done a good job of is learning along the way and saying, okay, this is, we wrote our first guidance, we had some issues, how do we improve it? And they really talk about how what's most important is the totality of evidence and ultimately patient outcomes. So I think there's areas that we can both team together and improve healthcare, and I think that's one. And I think for those looking for opportunities, I think there's innovation China's in this sort of life cycle of going from generics and copying to thinking about their own ideas and learning, and will become a center of innovation. And you have companies that have recently gone public in NASDAQ, and these sort of validation will help increase the sort of talent pool and the sort of future success stories. Hong Kong opening up a new board that will allow for IPOs of pre-revenue companies. That will be an interesting development, and seeing how that happens. That will be unfolding in the second half of this year. So that will allow additional opportunities for both local and regional companies to have outlets to the financial markets for these. And then as investors there become more sophisticated in this area, they'll also help build the ecosystem. So I think there's opportunities to help strengthen the ecosystem everywhere. And yeah, anyone out there is doing it, happy to team together. So yeah.
So the multiples in the Hong Kong market for China healthcare companies are very, very high. So we see some healthcare services companies getting from 20 to 40 times EBITDA, just really very, very high. And I think that's part of what attracts lots of investment, and maybe not such smart investment into the area. But that having been said, capital availability is great for growth and potential innovation. I think it's really important. Healthcare is different than any other industry. Customers of healthcare put their life in the provider. And so it's really important that investment in healthcare is not just looking at the opportunity for multiples, but the opportunity for doing the socially right and ethical thing, and being worthy of people's trust. And so as the Chinese government invites private industry to participate, I think we have a burden of responsibility to make sure we're doing the right thing.
Perfect. Well, thank you to all of our panelists. We could keep talking for hours, I think, but I think we've tried to touch on some of the important issues. And I don't know if any of them will be available, afterwards, to chat further with folks. But thank you all for listening to us for the last hour, and thank you again to the great panel.
Thank you.
Thank you, Jeremy.
Thank you so much to our healthcare panelists. We now are in for a treat. We have a fireside chat between U.S. NASA astronaut Leroy Chiao and Dean of Columbia School of International and Public Affairs, SIPA, Merritt Janow. She is also on SupChina's board of advisors. They are now going to discuss, which I think is so neat, U.S.-China space relations. It is now my pleasure to introduce Merit Janow.
Well, good afternoon. I am very much looking forward to this conversation with Leroy Chiao, a great American astronaut, engineer, and someone who I've never spoken to someone who spent 229 days in space. So this is really marvelous. So let me start by asking you how we should think about the space program in China. And I'm thinking, you know, pursuit of a space program, it's a spur to other industries.
Yes.
It's a sign of prestige and great accomplishment. And we know that China has already put man into space,
Right.
Has its own space station, has ambitions for the moon and Mars. So could you help orient us by, you know, understanding where you think China is in the
Sure.
development and its ambitions?
Okay, sure. Yeah, of course, China got into the human spaceflight program back in 2003 when they launched Yang Liwei as the first Chinese national astronaut into orbit. And so since that time, they've been making very steady progress and very measured progress. They haven't had the kind of the urgency during when we had the so-called space race, when the United States and the Soviet Union were competing with each other. It was almost like a crash program on both sides trying to one-up each other. And so what China's done is done a very methodical, purposeful, long-term look at what they want to get out of it. First of all, any country gets into a human spaceflight program mostly for national prestige, and there's nothing wrong with that. But that is a big part of the goal. And so they have methodically gone through. They've launched 2 small space modules into space. You can think of them as kind of mini space stations. And they have flown several crews there. I believe the longest crew spent about a month there doing operations, scientific operations and observations. And they are steadily improving their capabilities. They've demonstrated the ability to do spacewalks. And so, and they have announced plans to send their own astronauts to the moon sometime in the 2030s. They haven't set a firm date, but they've publicly come out and said what those of us in the business already knew was a private rumor, I guess.
Well, you know, of course, China is announcing many bold visions,
Right.
a very ambitious agenda for itself at home and in the world through Belt and Road and other initiatives. What are the spillovers from this kind of initiative? I mean, one reads NASA reports that our own space program has had real benefits for science and technology, sectoral developments, new materials, even education, food products. What are the kind of spillovers that one thinks of today from having a space program?
Sure. I mean, from our own program, you know, like I said, any nation that gets into this business, it's going to be a technology driver, right? So your space program is going to drive, in our case, miniaturization of electronics, lightweight and strong materials, you know, things like that. Medical advances, as you mentioned, there are a lot of areas where technology developed for NASA ended up being applicable to the medical side or other industries. And so you've seen what we call the NASA spin-offs, is the report that you're referring to is a publication that NASA puts out periodically to kind of highlight some of the benefits of the space program. You mentioned one thing, the education or inspiring, you know, the young, and I think that is, to me, one of the most important ones because it's hard to measure. But I remember what it was like when we were starting the Apollo program. I was, you know, pretty young kid then. But everybody, you know, the adults, all the kids, we were all so excited about it. And it made us I think it made everyone kind of reach a little higher and try a little harder. You know?
Now, you've been a commander of the International Space Station
Right.
and spent months in space with a multilateral group,
Right.
Japanese,
Sure.
Canadians, Russians.
Right.
Am I forgetting another jurisdiction? I think those are the ones.
Those are the,
Yeah.
yeah, the Europeans, of course, participate too, but I never flew with I trained with the European astronauts, but we never flew together.
Yeah. So why is it that Russia is part of that and China is not?
That's a great question because, when we started working with the Russians in the mid-90s, there was one group of people who thought this is a big mistake. What are we doing? They're going to come and steal our technology and they have nothing to offer us. Their stuff is no good. And then there's the other group that was a little more open-minded saying, well, you know what? I mean, this could really be beneficial for both countries, not just the space programs, but for the both countries. And I have to confess, I started out on the kind of like I said, I grew up during the Cold War. So I started out a little bit more like, why are we doing this? But then I quickly kind of came around to this other way of looking at it. And so one of the things that comes out of this kind of collaboration, I think it's clear. I don't think anyone would question that actually our relationship with Russia improved after we started working together on this very visible civil space program up there that everyone, has a vested interest is successful. And so I've been advocating for bringing China into this kind of a collaboration since I left NASA and was allowed to do so. And because I think the same benefits, we would improve the overall relationship between our two countries. So, that's something that I hope will happen.
So in this kind of collaborative framework, are scientists working together? Are technicians working together? Are astronauts
all of the above.
training?
Absolutely, yeah. Astronauts are training together because we're going to fly together as crews. When I trained for the International Space Station over the course of 3.5 years, I spent half of that time in Russia, 1 month there, 1 month back in Houston, training, learning the language, and the cosmonauts, the same thing. And then specialists, the engineers, the scientists, the managers, they all do the same thing. They spend a lot of time back and forth. We host them over in Houston. They host our teams over in Moscow. And, everybody kind of develops these really good working relationships. And that makes the whole program run very well. And I think it teaches us, even by that time I was a convert to believing in this international collaboration. But even so, it gave me perspective that kind of surprised me, because I'd traveled a lot internationally before, both on my own and for NASA, and enjoy it. But actually living in another culture kind of gave me a perspective of, why they hold certain views of world events that maybe differ from the way we look at it, And so it gives you that appreciation. And so I always tell young people, especially if you have a chance to study abroad or go work in a foreign office of your company, that really can be kind of a life-changing thing.
Mm-hmm. So we have a different approach to the development of space technology than China does, and I think a different mix, obviously, of public and private. As you think about the role of the private sector in the United States, one worries these days that NASA funding is not increasing. Directionally, are we continuing to invest, or maybe the private sector is picking it up by virtue of some of our amazing entrepreneurs? How do you see in the U.S. that public-private balance evolving?
Actually, it's very exciting. I think that's the most exciting thing happening in space now, are these commercial companies. And, of course, then the traditional aerospace companies always say, well, we've been commercial for decades, and that's true, but the model is very different because Boeing's and Lockheed's, Grumman's, and all those players have been building our spacecraft over the years, but it's been under NASA contract saying, here's what we want you to build, now build it for us, and we're going to operate it. Now, the difference is you have SpaceX and Blue Origin, so you've got Elon Musk and Jeff Bezos either using their influence and or their own money. In the case of Jeff Bezos, he's been self-funding Blue Origin all these years out of his own pocket. But they have a vision. They want to explore. So this is the first time you have a commercial company taking the initiative saying, we want to explore, we want to build infrastructure. In the case of Elon Musk, he says publicly all the time that he started SpaceX specifically because he wants to go to Mars. He wants to colonize Mars. Now, why? I'm not sure. I'm not sure why he wants to colonize Mars. I would love to explore Mars, but I don't want to live there. And Jeff Bezos has this idea of building infrastructure in low Earth orbit and also around the moon. And one of his visions is that he wants to move industries off of the Earth so that we have more room, humans have more room to live. And I'm not sure how that works either, as far as economically building factories in space and bringing raw materials and shipping product back down. But he's a pretty smart guy, so I'm sure he's done his homework.
Mm-hmm. So is the federal government continuing to invest adequately from your perspective?
Well, a couple of things have happened. NASA certainly today and for the last several decades is not the agency it was back in the 60s when it started. When it started back in the 1960s, or actually 1959, or 58, basically we went from nothing to NASA being created to the moon in 11 years. Okay, and so NASA, I think it's not really just NASA, it's any large organization has that danger of becoming very bureaucratic, tied down in red tape, and difficult to get things done. And so you become less efficient. You start taking a lot more money to do what you used to be able to do for less. And so, that funding level has been flat for many years. And so it's difficult to get an exploration program going by the traditional model. So for example, we started building the new vehicle that was intended to not replace the shuttle, but be the next generation spacecraft, and the rocket back in 2005. So instead of going for 11 years from nothing to the moon, putting men on the moon, we went from 2005 to 2018 now, and we still don't have an operational spacecraft, new spacecraft, and an operational new rocket. And so I think that we were talking about the commercial companies. I think there's an opportunity here for this real government commercial collaboration, and that would be really, I think, an interesting model, and whether or not it would work would remain to be seen. But I think, and it is happening at some level. SpaceX is one of the contractors, one of the companies being funded by NASA to help develop spacecraft to go to and from the International Space Station. The difference is they're going to operate it, and they're going to operate it commercially. Mm. It's under contract from NASA, and the other company is Boeing. Boeing also is building a commercial spacecraft. So the model is evolving, and I think that's the big excitement.
Mm-hmm. Is that the government is showing over time some flexibility by necessity,
yes,
in working with the private sector, and
yes,
that's producing opportunities for innovation,
right,
in the private sector,
mm-hmm,
one would hope.
Yes,
yeah,
right,
yeah,
absolutely.
Yeah.
Yeah.
Now, the Chinese government does not have that philosophy, if I understand, that it's really the PLA runs the manned portion.
That's right. That's right. That's something that a lot of people don't understand, is that the People's Liberation Army does run the entire human spaceflight program. China has its own civilian, China National Space Agency. That does all the satellites and all the space probes and things like that, but they are not at all, they're not at all running the human spaceflight program. So while you go to the Space Center in Beijing and nobody's wearing military uniforms, they're all part of the military. And so that's been one of the objections here in the U.S. about, further collaboration with China is that. But to me, it doesn't make that much of a difference. They're still specialists, whether they wear a uniform or not. They're still astronauts. They're still engineers. And, I don't see why that should be a roadblock to collaborating.
Do you have any observations about what the consequences are to have two agencies responsible for overlapping territory in China, what the consequences?
Right, and so I'm certainly not an expert on things like that, but you can imagine that if it's not a clean separation, which maybe it is, it's pretty hard to see a lot of things in China, as you know, but I think it probably is a pretty clean division of responsibilities. But you're going to have some issues because I don't know which side develops the communication satellites that their astronauts are going to use, and whether if it's built by one organization but it's used by another, and I don't know how close their collaboration is. There could be issues, and that's just one example. So managerially, I don't know why they set it up that way. I guess just maybe it was just being conservative, saying, well, we're going to, any spaceflight program, human spaceflight program, you start with military pilots as your astronauts, which China did as well. And so maybe at that time, it seemed logical to them to keep it in the military.
Mm-hmm. And there really isn't a commercial version of interaction occurring in China. China?
Not nearly like there is here. Now there are some startups. There are actually some startup companies that, trying to do different things in space in China. I interacted with one company not too long ago. They're a little startup. They want to put a constellation of small sats in low Earth orbit. Frankly, I was not very impressed with them. Unfortunately, I admire their enthusiasm and their zeal, but they didn't have much experience and they didn't have much. I don't know. Their plan seemed, not perfect to me. But it is starting. It's exciting that it is starting, that there are young people in China interested in space. They're interested in, starting these entrepreneurial companies and trying to get them going. There's even one company I'm aware of that wants to build a rocket and do commercial satellite launches. Now, it's hard for me to wrap my head around the Chinese government allowing that, at least right away. It might take some time. But we'll see how it goes. At some point, and the government has shown that they're willing to evolve. I mean, there was a time when we could not have emerging commercial launches from U.S. soil, and yet that's exactly what's been going on.
Mm-hmm. Say a little bit more, if you would, about these low orbit satellites. It feels like this is really an area that is increasing rapidly. There are a lot of new firms that are offering a vision of this being a vehicle for extending internet access at almost no cost globally. That's one dimension. Tell us more where you see the innovations developing.
Right, and so traditionally the communication satellites that we use are very expensive. They're on the order of $500 million. They're expensive to launch, probably on the order of $150 million to launch. You get them up into a geostationary orbit, which is about 22,500 miles up, and they kind of stay there, okay? And so that's kind of the traditional, satellite model. With technology bringing things smaller and lighter weight, now we're seeing a proliferation of small sats, where now the model is, well, we can produce these satellites smaller and cheaper, and so we can kind of launch them into lower orbits, not for the communication part. ComSats, you do have to send them up there because they need to look at that one spot on the Earth. But for other things like Earth observation, taking photos of the Earth, either commercially or for government contracts, communications, as you mentioned, not the traditional ComSat, but communications more like the internet, global internet that we're talking about. The model now is, well, we can build and launch these cheaper into a lower orbit. They'll decay and come down and burn up, but we can launch replacements. And so that's the business model, is we'll just keep launching these replacement satellites. And so it's pretty exciting. A lot of companies are working on that. The Earth observation, as I mentioned, even some of the big players are working on this global internet idea. And so there's a lot of activity going on in space, and it's going to be interesting.
Is it getting too crowded up there? I mean, one hears that there are an awful lot of satellites.
Sure, a lot of space debris problems, and these small sats are only going to create more collision opportunities in low Earth orbit. Fortunately, these are all tracked. They're launched into planned orbits, so you can kind of deconflict them. But the problem is when a satellite has reached the end of its life and it's run out of fuel, it can no longer be maneuvered, and so it's pretty much a derelict. And so it's going to take time for it to come down and decay and burn up in the Earth's atmosphere. And so that's where you have the hazard. Also, pieces coming off of spacecraft or coming off of boosters, bolts, things like that. Even flecks of paint or debris when you're traveling that fast. Orbital velocities around 17,500 miles an hour. And so you can imagine you could ruin your day if you come across another object like that. But that is the biggest concern for our spacecraft is the orbital debris. And the good news is that if it's low enough, it's in low Earth orbit, it eventually comes down and takes care of itself. But you've got to track all those pieces. And we can only track down to, not too small.
Tell us a little bit more, if you could, about where we should envision the real problems to lie between the U.S. and China in space, as well as the real opportunities potentially, if we were to get past those. Well,
I think the opportunities would parallel the opportunities we had with Russia back in the 90s. In fact, I think that's the perfect model to use because we got our astronauts and specialists together, and the managers and political leaders, and everybody got behind this common goal of, of an international space station or whatever that exploration program is. And we were able to improve not only our understanding of each other's countries, but also the relations. And so I think that's the big opportunity with China and collaborating together in space. The challenge would be, of course, there's the concern of some kind of improper technology transfer, and a lot of politicians, American politicians, bring that up as their concern. But my comeback to that would be, well, it's not like that would be any greater risk than having the Russians try to take our technology. Don't tell me that they're not spying on us anymore. And we obviously have the correct safeguards in place to prevent that from happening in either direction. And to my knowledge, we have had no improper technology transfers either to Russia or from Russia. In that regard. So to me, that kind of rings hollow. That shouldn't be an impediment to us working together with China. And so I don't really know why exactly. There's certain members of Congress, of the U.S. Congress, that view China in a different light than they view the former Soviet Union. And the cynical side of me goes back to, well, that's why the Supreme Court back in the day thought it was okay to incarcerate Japanese Americans during the war, and not German or Italian Americans.
Well, I think, is there a pathway forward at this point, or are we headed into a darker and more complex territory at this point?
Well, I think we are heading into more complex territory. When I left NASA 12 years ago, my thinking then was, well, certainly in 10 years' time, our relationship will be better, and it's actually worse. And that's because China has become very capable on its own. Back then, they didn't have a really, they were just starting their infancy of a human spaceflight program, and now they're building up their military. They're starting to, kind of become more of the more, visible, I guess, in their influence in their own backyard. And so that's put more, it's being used as ammo by the opponents of doing things with China. And so it's hard to see a course forward. I still remain cautiously optimistic. I'd like to see that happen, but it's difficult to see, what that path might be. Now, there's a little ray of hope there where I saw that President Trump and Xi Jinping, President Xi, did have very good meetings together. Both came out with very positive things to say. And so that's a little ray of hope that maybe that relationship can lead to some easing of some of the restrictions that we have.
Yeah, I think the national security concerns are mounting. There's no question. And if space is in that envelope, it will be very difficult to envision concrete collaboration in the near term. But one wonders on the human level if there are training or other things one could do that would improve. Right.
No, I agree with you. And, some of our partners are doing that. I know the Europeans, I believe they have some astronauts over in China now training together. The Europeans have made no secret that they want this kind of a world community. In fact, the European Space Agency has been advocating for an international kind of a moon colony, not colony, but, a base, a moon base where all, different countries including China, can participate. And so I know there have been some European astronauts training over there. And the fear I have as an American is, okay, if Russia collaborates with China, if our European partners and even the Canadians were talking about, working with China, where are we going to be?
Yes, we'll have missed an opportunity.
We will have missed an opportunity. I think by collaborating and leading this moon effort, which we should, we're the only country that's been there, we retain that leadership position in the world space programs.
Well, you've given us a few hints of what an ambitious agenda could look like. And, we're reading more and more about Elon Musk and Jeff Bezos' big vision. Is that the big vision, or is there a bigger vision still of what we could do in space?
Sure. Well, we've been talking about Mars for, I like to joke that we've been 20 years from Mars since 1969. That's when back in the 60s we thought we would be on on Mars before 1990. But, so that kind of still is true. We're still looking 20 years out. So that's kind of the big goal. I think nearer term, it's the moon. And I was also kind of excited to see the new architecture, the new ideas for exploration after the most recent elections, where we are turning more moon-centric again, and NASA's produced some ideas on how we would do that, and it leaves open the possibility of bringing in other partners in addition to the ones that we have. And so NASA, of course, is a government agency. They can't come out and say things like that, but it's exciting to kind of read the tea leaves a little bit. Of course, it's not funded yet. We don't have the funding, and nothing happens without funding. But like I said, there are a few little rays of hope there.
And what would we do on the moon?
Well, we would conduct different kinds of things. Of course, there is scientific research to be done on the moon. But for me, as kind of an operator, it's where we would all come together and practice for what we would be doing on Mars. Okay, so you want to test everything that you have, your habitats, rovers, spacesuits, operations concepts, things like that. You test them on the moon, and you train crews there too. You don't necessarily want your first crew that sets foot on Mars to be a rookie crew, right? So maybe you train crew there on how to operate all this equipment in a reduced gravity, reduced atmosphere environment. And so we want to do that on the moon because the moon is close. The moon's only 3 days away. If you have an issue, you can get your crew back pretty quickly. At closest approach, on average, we talk about 6-month transit times to Mars one way. So if something goes wrong on the way to Mars, you're going to take over a year to swing around and come back. Okay, and so you want to make sure everything's going to work first and get it all set up. And the moon, to me, is the perfect place to do that.
What a fantastic conversation. Please join me in thanking Leroy Chow.
Thank you. Thank you.
Thank you.
Thank you so much, Merritt and Leroy. That was exceptional.